And I'm just going to go through a couple of slides to form a framework. And then Eric is going to talk more on his part, and then we're going to have a general conversation. Let me see if my computer wants to advance the screen. Yeah. Let's see. Okay. So I think the first question we have to ask is, what is the responsibility of healthcare providers and institutions when we're watching this pretty horrifying live-streamed genocide? And so let's go over some of the principles of being a healthcare provider. We know that health and healing occur in a socio-political context. So people stay healthy or get sick or get better in the context of the culture and the social situation that they live in. We as physicians do take an oath to do no harm and also to engage in healing. So there is a code of medical ethics that we're supposed to adhere to. And the mission of healthcare is both individual, healing the patient, and societal, creating a society in which people can be healthy. Now, there's often a lot of confusion around the issue of medical neutrality, because I hear people saying, well, we can't say anything about Gaza because of medical neutrality. Well, medical neutrality, by definition, is a social contract. And that contract obligates medical providers and societies to protect medical personnel, both in times of war and peace. It also obligates us as the medical personnel to treat all individuals, no matter who they are, what their race, religion, ethnicity, politics, any category you can imagine. We are obligated to treat everybody equally. And violations of medical neutrality actually constitute crimes as outlined in the Geneva Convention. The other thing that you should remember, and this is something that Dr. Iyad El-Sarraj taught me, he founded the Gaza Community Mental Health Program several decades ago, is that health cannot occur without human rights. So I think that health and human rights actually work together. Now, I'm going to do the ever so brief overview of what's going on in Israel because my main focus is on the US. But just for some framing, I think, first of all, we need to remember that Israel is an active settler colonial state right now, engaged in occupation and siege, and that affects how populations think about other populations. And just as a sort of example, the picture on the left is a patient education pamphlet put out by Palestinian Medical Relief Society, and they're pregnant women. They get, breastfeed, don't smoke, those kind of things. And this is a pamphlet that says advice on what to do if you're caught at a checkpoint in labor, not a normal pregnant situation. So in this Israeli society, no matter how progressive Israelis feel about lots of things, there is pervasive anti-Palestinian racism and Islamophobia. And if you study the system, there's actually very clear-cut medical apartheid. And I was able to really understand that by documenting for years the COVID pandemic, where your experience of COVID totally depended on, are you an Israeli citizen or a Jewish settler in the territories, or are you a Palestinian in the territories? Because those two populations living side by side had completely different access to testing, access to treatment, critical things for COVID. And this is despite the fact that the Geneva Convention states quite clearly that occupying powers are responsible for infectious disease outbreaks and pandemics. There's also been a long complicity of both doctors and psychologists in promoting occupation and siege, particularly in the prison system, the Israeli prison system, where there are these providers have been active in torture programs. And this has been clearly documented by Physicians for Human Rights Israel and other Israeli organizations. On top of this, we have the 2018 nation-state bill, which privileges Jewish citizens of Israel over Palestinians. So there is an official institutional racism in the country and a general agreement that does not respect human and civil rights for the indigenous Palestinian population. So given that kind of social and political background, I think it's important to ask, are Jewish Israeli clinicians really able to see Palestinian citizens of Israel or Palestinians in the territories as fellow equal human beings? And I just want you to know that in November of 2023, after the Hamas assault and the Israeli response began, 100 Israeli physicians wrote a letter approving the bombing of Gaza hospitals. And since October of 2023, there has mostly been complete silence, except for one group, which is Physicians for Human Rights Israel. And they have done multiple reports on Gaza, documenting atrocities, starvation, restrictions on medical supplies, all the stuff that you know about if you pay attention. And last July, they issued a report where they documented the Israeli assault. And the report said, this is a deliberate, cumulative, and ongoing dismantling of Gaza's healthcare system and of the population's ability to survive. Its meaning, genocide. So they named it a genocide. And the same month, B'Tselem, which is an Israeli human rights organization, named what's going on in Gaza our genocide. They issued a report named Our Genocide. So that's a very brief overview of what's going on in Israel. But let's focus on US physicians. And I'm going to make some general statements that will make most physicians kind of unhappy, I think. I think if we look at the behavior of US physicians, they are historically not in the forefront of political activism or social justice. The focus in American healthcare is on the patient within a corporate fee-for-service kind of medical system. It's not on the society in which the patient lives. Doctors rarely ask, why do people come unwell? The focus is really on treating disease. And if you think about it, doctors have not been in the leadership of the greatest public health issues we face, like war, except for Ukraine. There was a lot of outbursts around Ukraine. And except for the International Physicians for the Prevention of Nuclear War, there's rarely any comments on war. And then you look at other major issues like gun violence, poverty, high maternal mortality, the food industry, the lack of universal access to high quality, affordable health care or insurance. There's very little physician voice on these very critical public health issues. And with healthcare insurance, the only group that I could think of was Physicians for a National Health Program. So the end result of this is that there is, particularly on Gaza, silence from medical journals, schools, and medical foundations. And I think some of that comes from a misunderstanding of medical neutrality, but I think it's really not about that. It's really about what we call Israel exception, so that you can criticize the behavior of any military, any country that you want, except Israel. And that's a pretty pervasive political stance in this country. And this is a reflection of the impact of, quote, pro-Israel and Zionist professionals and an acceptance of what's called the IRA definition of anti-Semitism. Now, IRA stands for the International Holocaust Remembrance Alliance. That came out in 2016. It was supposed to be a working document, and it tried to define anti-Semitism, and it used some of the classical things you can imagine, but then they gave 11 examples, and 7 of their examples was some form of criticism of Israel. And this has been widely accepted all over the country. There's also fear of angering donors, of losing funding. There's fear of having false accusations of anti-Semitism, fear of the MAGAverse, particularly if you think about Project 2025 and Project Esther, which is designed to crush the pro-Palestine solidarity movement. There's fear of pushback from groups like the Lawfare Project, which does suits against people, CAMRA, the Anti-Defamation League, Canary Mission. There are a long, long list of groups that surveil all speech on Palestine, all speech on Israel, and go after anyone or any institution that criticizes Israel. So the costs of criticizing Israel are very high. And so what that results in is a real refusal to publish or hold conferences with any information on Gaza. And this is in contrast to the United Kingdom, where journals like The Lancet and the British Medical Journal have published many articles about the realities of health in Gaza. So again, when you think about the things that doctors have not responded to, it's pretty stunning. So Rubio sanctions Palestinian human rights organizations for their efforts to withhold Israel being accountable to the International Criminal Court. Multiple human rights organizations in Israel, genocide scholars, UN agencies, the International Criminal Court named this a genocide. I mean, you could hide within all those groups if you didn't want to stick your neck out. All the mounting evidence of war crimes, violations of international human rights law, the massive death and destruction. Before the spring, 83% of those killed were civilians. Since the spring, it's been 93%. Including hospitals and staff, and hundreds of staff imprisoned and tortured, not a peep. The use of food and water as a weapon of war leading to famine. You'd think someone would say something. The fact that Gaza life expectancy has been reduced to nearly half of its pre-war life expectancy. It is pretty stunning that no medical professionals or journals have felt a need or a willingness to call this to public attention. So there are consequences to this silence. It's a real challenge to our idea of medical ethics. So what we see is that medical students, residents, and faculty keep reporting that they have pushback if they speak out. And the pushback is from colleagues and administrators. People report receiving hate messages, getting doxxed, having threats to their physical safety. People report losing residency options, being falsely charged with anti-Semitism. People have lost their jobs or been suspended. There's a huge amount of psychological stress for Palestinian healthcare workers and Arabs in general, people of color, Muslims, supporters of Palestine. And it's interesting, there's an organization called the Institute for the Understanding of Anti-Palestinian Racism. And what they found is that there's a huge amount of anti-Palestinian racism directed towards Palestinians, as well as people who support Palestine. And oftentimes it's people in positions of power, like your boss or your residency director, or someone who has the capacity to fire you. So their work is pretty stunning. And I think this silence corrupts and enables medical and military institutions to both ignore and condone and commit further atrocities, because there's no consequence to the country committing the atrocities. Now, I have had some personal experience with this, so I thought I'd share that with you. In 2024, I was invited by faculty to give 2 presentations on the health and human rights consequences of the assault on Gaza. So I flew from Seattle to Boston and arrived at Harvard University, where the talk was supposed to be at Brigham and Women's Hospital, to discover that it had been canceled. So the faculty who invited me rescheduled it at the School of Public Health. And then that was canceled. And I heard from people who were part of the faculty conversation, I did not hear this directly, but that a big mover and shaker in the Harvard University universe said that I was an anti-Semite and I was not allowed to speak at any Harvard facility. And that reminded me of back when I was an attending at the university in 2003. I was starting to organize health and human rights delegations to Israel and Palestine. And I sat down to talk with my department head, who was an avid Zionist. He would take doctors to Israel to study their fabulous emergency stuff. And I wanted to interview Jewish doctors just to understand how they thought about everything. And he refused to give me any names and told me that I was a danger to the Jewish people. Which was kind of stunning to hear. So then I went north to Dartmouth and to the Geisel Medical College to discover that my lecture had been postponed, as they said, until a better time, and I was unsure when that would be. So this is just a little vignette from my personal life. Last year, Hassan Jabber, who's a Palestinian-American nurse, was being honored by NYU Langone Health. She'd received a Compassion Award and then was immediately fired for calling the Gaza war a genocide. This year, Claire Rosen, who's a social worker at Mount Sinai in New York, was fired because on her desk she had a postcard that said Gaza must live. And Palestine Legal, which is a legal organization that defends people in these kinds of situations, in 2025 has reported over 1,000 requests for legal support for this kind of activity. Now, I want to do just a case study of the American Public Health Association, because you would think that a public health association would be able to comment on public health catastrophes like the destruction of entire healthcare system. So in 2023, after a very prolonged and very fraught discussion with a lot of very angry people who were defending Israel, a brief statement was made on the situation in Gaza. The following year, the same group that organized the statement but wanted something much more explicit was challenged by the leadership, and nothing was ever said. And this year, very recently, Professor Amy Hagopian, who's a longtime APH member, very well respected, she was singled out for her activism and criticism of Israeli policy. And APHA leadership decided to ban her from this year's conference in Washington. They canceled her membership, and they removed her as the elected chair of the International Health Section for her pro-Palestine activism. And this all happened after a code of conduct case was launched by 2 anonymous complainants. So what exactly was her crime? The first thing she was accused of was participating, along with 36 other people, including Jewish members of APHA, in a nonviolent visual protest at the 2024 annual meeting. And her second crime is that she helped clarify the purpose of the International Health Section's Palestine Health Justice Working Group by drafting and circulating its mission statement. And she was accused of violating APHA policy. And the folks who made the charge, although we don't know who they are, allege that she, quote, created a hostile environment for Jewish participants. And you see this a lot in efforts to suppress information on Gaza. The Jews don't feel safe. They feel like it's hostile and they can't do what they do. And I would suggest that there is a big difference between being unsafe and being challenged and uncomfortable. And that this is actually an example of Zionist fragility, of being unable to tolerate a challenge to your belief system. And I had a little number of things, but I had a personal experience with this. I made a documentary film called Voices Across the Divide, which was a history of Palestine as told through the voices of people who lived the experience. So it was basically a storytelling documentary. And at the end of it, this Jewish student came up to me at Boston College and said, I feel unsafe watching your movie. And that for me really was an example of Jewish fragility. And I think it's important to remember that anti-Semitism is a real threat, but that this kind of behavior is not anti-Semitism. And it's interesting that the Code of Conduct Subcommittee and the Executive Board made no response to Professor Hagopian's 11-page response letter or to the 36 letters of support that came from APHA members and leadership. So when you put this all together, you can see that the decision to suppress her and oust her is really capricious, and it violates due process. It violates fairness and APHA values. And the goal of all of this is to silence a person who has a strong voice in support of Palestine. There are good news, some exceptions to this dire situation. One is an organization called Doctors Against Genocide, which formed shortly after this assault started. And this is a group that does a monthly politicking on the Hill in DC, visiting senators and representatives. They just had their second annual conference, which I actually spoke at on reprocide, or the impact of the genocide on reproductive affairs. And they do demonstrations and they do weekly webinars. And so they're very much into educating and agitating. Then there's the Jewish Voice for Peace Health Advisory Council, which I work with. As mentioned, we've done a weekly health and human rights report, and we also publish actions to do, and we also do webinars on the topic of the Gaza genocide and what else is going on. The U.S. Palestine Mental Health Network is also a group of mental health activists who have been documenting the mental health implications of the genocide. And then you may have heard of the Jewish Healthcare Workers Letter. I worked with 7 other Jewish healthcare workers, and we wrote a letter calling out the genocide and then calling out the medical journals that refused to publish anything about the genocide. And we issued it on Rosh Hashanah of this year. And within 2 weeks, we had over 1,000 signatures. And if you are a Jewish healthcare provider, feel free to go to the website and sign it. Our plan is to bring this letter and all of its signatures to medical journals to try to pressure them to open the gates on information on Gaza and healthcare. And when I reviewed the ability to find anything on Gaza and health and human rights in the last 2 years, I was able to find the Health and Human Rights Journal, which had 8 articles on Gaza. One of them I wrote, so I don't think that actually counts, but that's the level we're looking at, 8 articles in 2 years from one journal. Now, it was very exciting to me that on October 3rd, the New England Journal finally published 2 articles. One was called On Bearing Witness, and the other was called Standing by Our Colleagues in Gaza, a Plea to the United States. And I know the people who wrote that second article, they worked for months to get this published. And finally, the journal decided to publish it, but they would not let them use the word genocide. So it was sort of a half win. And that's the state of medical journals at this time. So I'm going to stop sharing and give this over to Eric.
Thank you, Dr. Rothschild.